I think the more we have people like Pat Summitt come forward with the diagnosis, it's encouraging to all the people out there who are dealing with it. Over 5 million people in this country, with another 10 to 15 million caregivers at any given time. So to have somebody as popular as she was come forward and say, I'm afflicted with this disease at a rather young age, but we're going to do what we can, we're going to fight it, we're going to try to help each other get through this tough times. At the same time, try to do something for other people, those who follow us, by raising awareness, attention, and ultimately funding for research for this disease. Early onset dementia, or early onset Alzheimer's disease in particular, can be genetically driven. That is, in general, most diseases that present early in life have a greater genetic contribution to them. So if somebody gets Alzheimer's disease in his or her 40s and 50s, it's likely to be on a genetic basis, but not always, because we have seen people here, early 50s, develop the disease. We go through the genetic screen. It's not in their family, but bingo, it is in fact the disease. So in general, young onset has more of a genetic familial component, but not always. It's commonly thought that early onset Alzheimer's disease is more aggressive than late onset. There certainly are cases where that does happen, and we're not exactly sure what is it about the disease. On the other hand, young people tend to be healthier. They may not have other medical comorbidities, so they may actually survive longer because they generally are free of heart disease, diabetes, cancers, and the like. So it can be a more aggressive disease, but not always.